And joining us now live from Tekirdağ, Turkey is Associate Professor Dr. Nejat Altıntaş to talk about the recent developments in terms of the coronavirus vaccine in Turkey. Dr. Altıntaş, thank you so much for joining us.
Thank you for having me on the show.
Absolutely.
Thank
you. To start off, can you just give us a brief overview of what the latest developments are in terms of the vaccine?
Yeah, for now there are 5 vaccine companies which are very close to roll out their vaccine, their jabs. The first company is, as you know, the Pfizer and the BioNTech company. BioNTech is the German-based company. And the vaccine was shown that it's effective in up to the 95% in the people. And also it's given in 2 doses. The interval between the 2 doses are 3 weeks. And it was, they enrolled for 3,000 people for vaccination. And the only problem with this vaccine or this jab is you have to store this vaccine at minus 70 degrees. So it is very difficult to handle this vaccine for transportation and for the storage. But on the other side, it's very cutting-edge, high-technology vaccine because it's a mRNA technology vaccine. The other one is, as you know, the American-based company Moderna is also effective up to the 95%, and it's also given 2 doses. But this time, the interim or doses interim are you have to wait 4 weeks. The interval is very long, and it has been tested on 30,000 people, and it's very. I think it's at least easier to handle this vaccine because you can store this vaccine up to the minus 20 degrees Celsius. So it's easy. And this vaccine, I think, will be clarified on January 12th by Federal Drug Agency and EMA, European Medicine Agency. The first one will be clarified 29th of this month. The other cutting-edge technology vaccine is the AstraZeneca, you know. It is a weakened version of the common cold virus, which was produced from chimpanzee that has been modified so it cannot grow in the humans. It's a vector-based vaccine. It's also cutting-edge technology vaccine. This vaccine is the cheapest one. All the inside of the 5 vaccine, and it is effective up to the 70%. Interestingly, if you give the first shot in a half dose, it is effective up to the 90%. But on the other side, if you give the first shot in a full dose, it's effective up to the 60%. So average is 70% it is effective. And you can store this vaccine in normal refrigerator. You don't need so much cold degrees. On the other side, we have a conventional vaccines, just like the Russian vaccines, Sputnik 5, and also Chinese vaccine, Sinovac. These are conventional vaccines. We don't have interim data, I mean phase 3 trial data for Chinese vaccine, but we have the data for the Russian vaccine. It's also effective up to the 92%. So the vaccines are, I can say about this information.
So one question that is on a lot of people's minds is people who have already healed from the disease, should they be also given the vaccine despite the recovery, or do you think they do not need it?
It's a good question. Thank you. All my patients are asking the same questions to me. You know, after 3 months, there are some studies have shown that after 3 months, the antibodies, you know, which fight with the virus or with the disease, they have been decreased up to the 26%. In other terms, you don't have antibodies to fight with the virus after 3 months of healing. But on the other side, we have other studies which have shown that they may last up to the 6 months. And there are also other robust defense cells, we call them so-called T cells. They can also fight with the virus even in the absence of the virus. So there is a dilemma between studies. And also we know that if you have the injection, if you get the jab, we know that the antibodies that has been produced because of the vaccines are much more robust, and also they may persist for longer time. So the answer for your question is they should get the injection after healing. Yes.
Now, how sure are we of the effectiveness of vaccines and if they're reliable enough or not, considering the fact that before this, scientists and doctors were saying that in the past, in the 1920s, Spanish flu and other major pandemics in history, usually the process of developing a vaccine takes somewhere between 5 to 10 years. This, would you
10
say,
years, yes.
would you say this is because of the technological advancements that we are able to do this? It's kind of marvelous how we've done this. We're at the stage within a year almost only. So how reliable is that data, considering the fact that normally this process takes about 5 to 10 years, and yet we're standing here in about a year? What do you have to say about that?
Yeah, because firstly, we have an experience about the vaccines, and we have experience about this disease. You know, we have the adenovirus. This type of coronavirus infection in 10 years ago. You know, in SARS-CoV-1 and also MERS infection. So we learned the data and we learned how to produce vaccine, and there was some progress in the vaccine development. On the other side, you know, there's an artificial intelligence, and we learned also how to produce the vaccination with the mRNA technology. So we learned the mRNA technology, we have the artificial intelligence, and also we tested with this vaccine on enough people. I mean, you know, the Pfizer company tested the vaccine on 43,000 people. I think that they are very reliable. On the other side, Chinese vaccine is also very reliable because it's a conventional vaccine. We learned this type of vaccine from BCG, I mean tuberculosis vaccine. So the scientists know that this type of vaccines for about 100 years. So the common question coming from my patients are, if the Chinese vaccine jab comes to Turkey, shall we get injected? I'm telling that if the Chinese jab come to Turkey, yes, they should get the injection because it's a conventional vaccine and it's a safe vaccine. Also, it is tested in Brazil, Indonesia, and Turkey. But at the moment, we don't have interim data. So when we get down to nitty-gritty, maybe there will not be immunization because we don't have phase three interim data. But apart from that, I think it's a safe vaccine, and we should get this vaccine, Chinese vaccine.
So what do you say to the people? Why are there certain people who are saying that they don't really trust the Chinese Sinovac vaccine because they find it to be unreliable? Why do you think that is the case? There's a lot of people who are saying that. And what would you say to those people?
Because we don't have the phase 3 interim data. We don't know it's effective. We don't have side effects. But on the other side, we have a preliminary data in Turkey. And also know from my friends, they tested or they get the jab. And I know that when they get the disease, it's not so big problem, their disease. So, what I can say that, so we have the interim data, not interim data, but we have a preliminary data. It's a reliable, it's a conventional inactive vaccine because the virus is produced by heating and it will not be so harmful for our body. So when we get to this Chinese vaccine, I will be the first one to inject it.
All right. So my last question, just when do you think Turkey will be getting its first shot?
At the end of this month, we will get the first shot, maybe. And we also have the interim data for the phase 3 trial in Turkey. So the first injection will be in December 12th, this month. And 10 million doses will come this month, 20 million in January, and 20 million in February. At the end of the February, we will have 50 million doses. So we will inject the 20 million our citizens. I think it's not enough for herd immunization, but for that moment, it's a good number.
Dr. Nejat Altıntaş, thank you so much for speaking to us and giving us your insight into this process.
Thank you for having me. Thank you very much.